Gotcha. Okay.
No, I was just looking Yeah.
Put out 20 for that.
Did they?
I did.
You did? Wow. Nice.
Parked the car and walked in.
Heck yeah.
I got my steps.
Somebody's got to. And we just like, especially on the last week, it was like, it's all with the verbs, the flyer mail, the emails, it was so soon. So I won't be surprised too. You know, if you come to the last week, you come to this.
I'm alright, I hope.
They come to the final one.
Yeah, I got 4 miles in somewhere. Of course, I did 2 other work, but probably 2 of those. Walking to the front.
Like the neighborhood is just good. Like they actually look at the flyer.
Yeah, most of them. The business, the small business. Oh yeah, put it right out front. They're
Good little.
yeah, that's there that close it down. I'm thinking there's half off.
It's the one that's like
Very low.
right next to.
Yeah, a lot of these stuff in there. Yeah, about my wife. That band is chill. Yeah, that was the room last night. Yeah.
And they know where it is.
Yeah. There's not much break.
Because they got Mansfield Pride.
Yeah.
And I can
And then the budget presentation last night too, right? Odd because they don't eat right. Just eat it like
Probably why
another.
it's my favorite.
No.
Yeah.
We gotta go back to,
Yeah.
after they hadn't even flipped over on page 2 of the 3-page agenda.
Wow.
And I was like,
Maybe that's how it's.
Technically, it's better.
I thought they could at least take the time. I mean, you know, a little bit less skills.
no, then when they went Waffle House.
Yeah, no, I did. I don't know about sugar. I'm on there.
Well, liquor one, get you another one of these.
Grandma said she was gonna fix her. I'm gonna choose
Is it yours?
No, literally she left. It was like 9 o'clock. She was like,
Love to help my ADHD. I'm like,
and you're watching her.
Oh,
They
they
did their kick out of the Waffle House, and she didn't like either of us.
Then I don't get something there, but don't work out.
Meanwhile, here I am. I've got
No, we went.
brains off my plate, but I'm eating with cookies.
Yeah. It doesn't matter. If I eat that's not what we're doing. I would still just eat something.
Like,
It's crazy.
We'll probably get started about 6:10 just to let everybody else kind of, if there's any stragglers coming in. So feel free to, after we get done, or now, however many cookies y'all can eat, and pinwheels, and we got some pasta salad back there too. So apologize, it's not as on the same level as the Rocky Mountain, right, Mr. Dancy? But yeah, we did bring some refreshments out.
Meatballs.
They were good now. They were really good.
Oh, wow. We talked to
What did you do at the county line earlier? I've seen you hit that one multiple times lately.
Same guy.
Which one? The one that from the hospital? Okay.
Yeah,
the ICU guy.
Yeah.
You tell 41?
I did.
I was curious.
I did.
I meant to tell him too the other day, but I didn't even think about it.
Yeah,
Glad you said that.
I told him at 8 o'clock and 5 o'clock.
What was it, Jaden?
Jaden and Jasmine Bowser.
Yeah. Okay.
But they said something about there was like a TV show coming on. They wanted to. So
Maybe.
Mr. Brown said he saw you at the event today. Training or what was it, Antwan?
No, it was another one.
No, I have a very similar.
Yeah,
I have a familiar face. Is it enough?
Well, yeah, this was another one. She Shelf was looking like
She looked like this.
looked at anything.
Oh, I think I know. Then she was in the sheriff's office.
So she was environmental.
Wait, I know who you're talking about.
Okay. Costa Rica. She was like this. She see that. She was
She like wants to go.
And I thought, and I thought
That dinner y'all were at the other day.
No, that's what we thought, but it's not that one. There's only one other one. She's the one with the dog that I thought was close to. There's so many.
She met one from ECU today.
Yeah. Yeah.
Oh, wow.
Oh, yeah. But she's in the
Still keep it together, so the Asheville with no blood, the stress from all, some ambulance, and he is in there. I got some age. One person, yeah, that's it, yeah. So she's been good, I gave it to her. Made it happen. You know, stuff happens. Yeah.
All right, I think we get this party started this morning, or this afternoon, I guess, rather. Thank y'all for coming to Pinetops. It's good to be here. This is the first time we have done this in Pinetops, so we're happy to be a part of the community down here and share the love. We were in Rocky Mount last week and be back in Charborough next week on the 11th. So if you don't get enough of this tonight, you can get it again next week. Couple of housekeeping things. Like I said, feel free to take as much food as you like. If y'all need to hit the bathroom, it's like you walk right out of here and it's just in that corner back there. So feel free to hop up, hit the bathroom. And yeah, so my name is Dalton. I'm the opioid settlement coordinator here in Edgecombe County and also manage the post overdose response team. So we'll talk a little bit tonight just about what the opioid crisis is and how we're dealing with that locally. We've got some statistics to show you all as far as what our numbers are looking like this year. And we'll kind of show y'all some of the things that we've started recently to try to help out with that. But yeah, so that's pretty much the overview of tonight. If you've got questions along the way, definitely let us know. We're happy to answer those. And in the end, there'll be a spot for y'all to give us some feedback too, either through a survey or if y'all would like to say anything. We're definitely happy to hear from you all about that as well. So a little bit about the crisis and a little bit about the opioid settlement. Y'all probably heard that before. The opioid crisis, so when I say that term, opioids are referring to a specific type of drug, right? So heroin or morphine or fentanyl or things like that. Y'all probably heard of those things. And before, kind of in the late 90s, it was just prescription pills that people could get hooked on, right? And initially, a lot of those were sold as non-addictive. You can take them for moderate pain. But what happened is that people started taking them. and for whatever reason, they got kind of hooked on them, right? And they were very hard to come off of. Because when you go through opioid withdrawal or you don't have those opioids in your system, you become really, really sick. So that could look like nausea or vomiting or body aches or different things like that. And the easiest thing to do is to continue to use, right? So kind of started off as prescription pills. In the early 2000s, 2010, a lot of those pill mills and doctors got in big trouble, and it was hard to get those prescription pills. But like I said, we had a lot of people in the community that were hooked on an opioid. So they turned to something from the street. And the popular drug at that time was heroin. Heroin could be injected, it could be snorted, it could be smoked, a variety of different ways, right? I know we think of like needles and stuff when it comes to heroin, but it could be given a bunch of different ways. Fast forwarding a little bit further, heroin was very hard to manufacture. It could only be produced from like a plant-based type of deal, and it had to be melted down and distributed that way. So the drug dealers got really smart, and they said, we need something that's more powerful, cheaper, and can be made anywhere. So today we're dealing with synthetic opioids. Fentanyl is like the thing that comes to mind and with most people. But one of the big changes that we've seen is that the opioids or the heroin is anything but. It's just this opioid soup of things. There's all these different chemicals in the opioids now, and it has changed the game, right? We don't expect stimulants and opioids to be in the same pill or to be in the same bag, but oftentimes that's exactly what we see. And that complicates the recovery process even further. So we actually test street drugs and things like that. We have a list that we send out once a month. So that list will be coming out probably next week. We'll get our intern Anusha in the back to work on that this week. But we're glad to have her. And so kind of moving on, what happened is that all of these pharmaceutical companies got in trouble for selling this stuff as non-addictive. So there was a lump sum of money, and North Carolina, basically signed on to the litigation with this. And from that, each county in North Carolina started to get money to combat the opioid crisis. So in North Carolina, on average, we lose anywhere from 8 or 9 people every day across the state to opioid overdose. Opioid overdose also is responsible for more deaths than motor vehicle accidents and gun violence put together. So that is a big deal. The problem is that this issue has kind of flown under the radar for so long, and we've made, I guess, the stigma around people with addiction, we've made it embarrassing for them to get treatment and embarrassing for them to seek care and other things. So we're trying to change the game for that. This money has helped a lot. In Edgecombe County, believe it or not, we have some of the most aggressive and most innovative strategies kind of across the state with trying to do better with this problem. And we'll talk about some of those things. But saying that to say this, right now we're projected to have the second highest overdose death rate in North Carolina as well. So that is one of the scary things, and one of the, the programs are good, but in the end, we still have this problem, right? So that's where we need the community to get involved and to help us seek out people and get them into treatment and try to get off of drugs. A lot of times before, yes, sir.
When you say, what are you saying, in the state or Edgecombe County?
So the state opioid death rates, we're number 2 right now. Yep. Richmond is number 1 and we're number 2 at 86 per 100,000. Edgecombe County. So the statistic is divided into 100,000 citizens. So any of the deaths that you have, that rate is basically, so we had like 43 deaths or something like that. And since we don't have 100,000 citizens, that's where that rate kind of comes from. So it's based on 100,000 citizens. We had 42 deaths. That's why it's at 88, because we have like 50,000 people here, if that makes any sense. A lot of places saw the numbers started to decline in 2023, but we have not seen that. So a lot of the big cities and places like that, they also saw overdose death reduction, but our numbers are going up. And it seems to be that the young, like anywhere from 14 to 22 is really, we're seeing a big change with that group. We have a number of 15, 16, 17-year-olds that we've had to put into treatment programs to get off of the opioids, and it's really scary to me.
I have a question.
Yes, ma'am.
Mentioning that about the treatment, so like, in North Carolina, there are really no type of residential places for that age group. You know,
It is hard, yeah.
to be able to go to for treatment. You know, are there anything in the future maybe to kind of increase these places? Because I think that they won't take it unless you're 18.
Some places, that's
Some
correct.
places
Yep.
they'll start at 18, but like if you have a 14, 15, 16-year-old with an opioid addiction, there's no residential place, especially since they've closed down Holly Hill. You know, they're not accepting teenagers anymore.
Right.
So what do you do?
Yeah.
You know, how do you combat that?
Yeah,
Well,
that's a great question, and that's one of the challenges that we've had is treating people that young for sure, because most places won't even start Suboxone until you hit 16. But you know, the clinic here at Freedom Hill, they started it earlier than that, which is really nice. So they're doing a great job there. But that is one of the challenges that we're facing is as these, you know, this opioid stuff is getting pressed into the pills look like medicine. Somebody can get hooked that early on, and we're seeing that. So it's just one of those things we're working through. There are some adolescent treatment facilities that we're aware of, and we can do some referrals to those places. But sometimes that's the best thing for the patient, and then sometimes also it could be best for them to see like a doctor's office and do more of like outpatient style. Yep. So we've seen a lot of good success. SAMHSA, which is the Substance Abuse and Mental Health Authority, they say that 80% of people with opioid use disorder can be successfully treated through outpatient. And I believe that. Yeah, I believe that too, especially if we're able to treat mental health, substance use, and primary care at the same time. So that's kind of the goal. And Freedom Hill is one of our biggest partners to do that there. So, like I said, back to the money here. North Carolina got, you know, over $50 billion. 85% of that money goes directly to the counties. So that 15% stays with the state to do the administration of the grants. They have some different programs that they're doing and things like that, but the majority of the money comes to the counties. The cool part is that each county has to do the procedure the same way, right? So like in order to use the money, it's the same way in Edgecombe as it is in Wake and as it is in Durham, but each county gets to pick what they want to do to best fit their community, which is really nice. And we can talk about a little bit about that too.
Before you move on,
Yes.
So every county in the state of North Carolina has gotten some money.
That's correct.
But do the people in every county know this?
I don't think so.
Okay.
Right? Yep, I don't think so. And not every county in North Carolina is utilizing the funds. Yep. So the money actually started hitting the county's bank account in 2022. And one of the early discussions that we had in Edgecombe is that we need to do naloxone or Narcan. We need to have a program to go out and find people when they overdose and help them into treatment. And then they had a syringe program at the health department in 2019, but that was also, you know, where we could increase some of the funding as well. So that was kind of like the early on conversations, right? So we got our start May 2023. We started spending the money, so we're only like a year in. At the time, from when the money was dumped to when we started using the funds. Now, fast forward a little bit, we have expanded, and we'll show you some of the things that we're doing now. But still to this day, certain counties in North Carolina are still not using the funds. And that's for a variety of the reasons. But the problem is that deaths are still occurring, and, you know, there's still all the stigma about seeking care. Yes.
Was the funds to the county the same for each county, or was it based on like the rate of deaths?
That's a great question. So the initial calculation was citizens that live there and death rate, or some of the opioid statistics that go along with that. And early on, our numbers were not that bad. I mean, they were bad. Don't get me wrong. People were dying, but they didn't look that bad. And that's how this initial $5.03 million came about. Fast forward, our death rate has climbed. We're a lot higher than 98 other counties, and that's unfortunate. So we have to really leverage this funds to hopefully make an impact on that. But that's how the original calculation was. Most places, I think we're getting 0.041% of the total 50 million or whatever. Yep. So smaller counties get less money. But, you know, counties of our size that had more deaths, they may get a little bit more funding than us. Okay. So this is the map of overdose deaths across North Carolina. The hot colors are like more deaths are occurring, the rate. And then the cooler colors, like in the blue and things like that, there's less deaths happening there. Okay.
What's the difference between Edgecombe and Nash and Wilson?
Yeah, so Nash was like 60, I think. We were 86. They went from 62 last year to like 19 this year. We're not sure if that's a reporting, like something is up with the reporting, like maybe there's some late cases coming in there, but they saw a dramatic drop, a really, really, really crazy drop. It went from basically this to way down there. This is public data. I'm happy to share the link to this. You can go to like the Core NC dashboard, and under that you can go to I think it's local trends or something, and then from there you click the overdose epidemic data. It's something like that. I'll send the link out to you guys to view that, and then you can type in whatever county you'd like here. But even the North Carolina average is doing this downward trend somewhere around 2023. Yeah, but still, people, there's too many deaths occurring. Around the nation, they estimate anywhere from 210 to 230 people die every day around the nation. So if you think about it, I always like to use like a Boeing 747 as a, like if you were to pile that full of people, it was crashing every other day, basically is what it was. So that's a lot. And overdose deaths are preventable. We have the antidote, right, naloxone. So, this, I think, sends us to our website. Yeah. Is that right? So if you want to check out our website, check out some of the local spending, check out the post-overdose team or some of the other strategies, that'll get you there. I'm happy to share the PowerPoint and all that good stuff as well. All right. So kind of going further about the memorandum of agreement, basically the law that tells us how we have to use the money. It's broken up for a couple of different ways. You have Exhibit A strategies, which is a list of like 12 different things that you can kind of pick and do. And then if you go through this collaborative strategic planning, you can unlock the door to Exhibit B strategies. And those are more specific. They have to be renewed every like 4 years. There's some more, it's a little bit more technical to get into that, but that's kind of where all of the prevention stuff is. So we're working towards that to unlock the door for option B. But right now, everything that we've done is Exhibit A or option A. This is the list. Like I said, there's 12 different ones, and we're doing 6 of those. All right. So collaborative strategic planning, that's what pays for the refreshments. That's what pays for bringing everybody together for meetings and collaborating with the community and getting their input. Evidence-based addiction treatment. That one is new this year. We opened up a request for proposal with the community because we needed more people to do medication-assisted treatment. If we're finding more people that need treatment, we need to be able to successfully refer them to get that treatment, right? So we had to open up a process to get some of that money to some of the people that were already doing that work in our community. And we talk about who got those awards soon. Recovery support services, that was initially the community paramedic program. But we found ourselves to be doing more of like post-overdose response. So we changed the language between recovery support to post-overdose response teams. But it's not a really great word for what we do because Trent went to an overdose today. So sometimes it's during the overdose, not post-overdose. And sometimes we meet a patient who has not overdosed before and we're kind of pre-overdose, right? So that's basically meeting people where they're at, people in the community, going to identify people and get them into treatment or do some education. So that's what post-overdose response team is. Naloxone distribution, I brought some Narcan here today. Like I said, we used the grant funds for that. So if you don't have a box of naloxone, please take one with you. We're happy to show you how to use it, and it could save a life sometime, right? Syringe services program, that has been around since 2019. I would like to change the name to harm reduction program because what it is for the people that are using IV, there are risks associated with that, such as hepatitis C and syphilis and HIV and all of those things that people don't want. And our rates were already high with that. So this is our way to meet people, to get them to use clean and educate them on how to be safe about it. And then for them to trust us for when they do want to get into treatment, we're able to plug them right in. One of the other things that we can do through that program is we can test their blood on site free of charge to see if they have anything. And if they do, we can get them right into treatment. So this is our way to try to decrease the spread of bloodborne pathogens.
Oh, you're able to test for like hepatitis and HIV and.
Yes, ma'am. Yep. The way it works is we take a tube of blood and we send it to the state, and in about a week or so we hear back. We have wrote a grant for a point of care hepatitis C machine, which is where we would take some blood from someone's finger and we would know immediately if they have the hep C or not. Yeah, hep C is curable, right? That's good news, but you don't always know that you have it. That's one of the scary parts. The other ones are some strategies associated with like the jail or people coming out of incarceration and things like that. One of the problems with being locked up for drugs is that if you're locked up for drugs, your tolerance goes down, right? Because you don't have access to it anymore. And when you get out, you are more at risk to overdose because you go back to the same thing, using the same amount, whatever. You're 40 times more likely to die within those first 2 weeks after incarceration than anybody else. That's a scary number. And that study was done in North Carolina. So these are kind of the 4 that we'll focus on today. The post-overdose response team, y'all seen the vehicles outside. That's what we ride around on. The naloxone distribution, we brought some of that today. We also distribute naloxone on every ambulance across Edgecombe County, all the EMS vehicles, for anybody. It doesn't mean if they have to go to an overdose or if somebody says, hey, I want some Narcan, they can get it. The health department, both Rocky Mount and Tarboro, give naloxone out. And we also put a vending machine at the sheriff's office for people like the sheriff's deputies and people leaving the jail for that reason that we talked about for tolerance, right? Unfortunately, that one's not publicly accessible. It's there for the inmates and for the detention staff. But if you need Narcan, feel free to give me or Trent a call, and we'll meet whoever, wherever, and give it out. We have these devices called one boxes. They look like it's like a box that the Narcan goes in, and it has a video screen on it. And when you open it up, the video comes on and it walks you through how to give it in the moment. Because some people, that may do EMS or maybe a calm person might do okay, but some other people might get a little excited and not know how to do it in the moment. So this is a way that we can put a device in a library or in a industry somewhere or in a restaurant, and they can still give that treatment. And the reason we give naloxone is to help somebody breathe again, right? Because I don't know how in tune you are with the emergency services department with Edgecombe, and we're doing a great job, but it still takes about, on average, 8 minutes to get an ambulance between the time you call to the time one's pulling up in your driveway. But if Pinetops is out already on a call and you overdose here, that truck from Tarboro or Rocky Mount may have to come, and it may be longer. And I can't hold my breath for that long. So that's why we have to get this stuff out to the community, because someone needs help immediately with that. Evidence-based addiction treatment. So we had one MAT provider in the whole county that was doing treatment for opioids. That was Freedom Hill Community Health Center. So they got stacked up. When we got our start, we were sending them people over there, and it was completely stacked up. So sometimes appointments would get further out and further out. So we gave them some money, and they're able to open up 14 more additional appointments every week to work people in quicker, and that's been great. Also, you cannot get methadone in Edgecombe County. You have to go to a different county to get that. We don't have what's called an OTP. We knew some patients needed the methadone, and having to drive over to Nash County or Wilson or Greenville was a barrier, right? And sometimes the treatment is expensive. So we work with Rocky Mount Treatment Center. For anybody who comes over there for Edgecombe County, they're Edgecombe County resident, we can subsidize their treatment to make sure that they can get what they need. And then their staff then works with them to get insurance handled or to get the ball rolling on any other outside resources that they might need to help financially cover that. So that's for it. It's in the treatment center is in Nash County, but the money that we gave them from our money is for Edgecombe County residents, if that makes sense. Yes.
Do you happen to know how, for the MAT provider, they were able to expand their capacity by 14?
They add additional doctor. Mm-hmm. Yep. They did. These are just some of the pictures. We go and we do a lot of talking around the state about what we're doing here in the county. And those are just some of the pictures there that was recent. We do a lot of community events. We're out there at the Happening on the Common. We'll have a booth set up. We'll talk to people about drugs, or if they want to talk about Narcan, or if they just want to talk to somebody. We try to show up as much as we can. Just this fiscal year, right, we've trained, almost 450 people on naloxone. And that's outside of people that we already know using drugs. That's just community people.
I have a question about that methadone.
Mm-hmm.
And I don't know, I'm a coder, but I don't. So if you're addicted to an opioid,
Mm-hmm.
and they give you methadone to treat your addiction,
How does that make sense?
Yeah. How does
Yeah.
that make sense?
So one of the reason that works is because the street drugs, we don't know what's going on. It could be all this fentanyl. It could be all these other chemicals, and that's what they're used to, right? If we can transition them to a medicine that we know exactly is how much is in there, we can work with them they don't have to go through withdrawal, right? That's one of the reasons that stopping drugs is not necessarily the safest thing to do. But it also makes you feel real bad too, right? So if we can transition them to a medicine that will prevent those withdrawals, then we can then start to wean them down, right?
From the opioid.
From the addiction, right? Exactly. So we're kind of replacing, in a way, but we're replacing it with something we know what exactly is in there, and then there's some ways that we can wean people down. And methadone is really for people that have really, really high levels of tolerance. Suboxone may be better for someone who doesn't have that high of a tolerance yet, but those are much safer. Suboxone and methadone can be given to pregnant people, so they are safe medicines and they work well. But like I said, if somebody stops cold turkey, their tolerance goes down, and all of a sudden they slip up and they use again, they're at risk for overdosing. So that's really why we try to push the medicines as much as we can. If they transition to the medicines, a lot of those medicines will prevent them from overdosing, which is good. We don't want people to overdose. And then not only are they getting medicine, but they're getting therapy and some of the other needs handled while they're there. Or if the mental health is a thing, they can get that service there as well. We can actually start Suboxone in the field through Trent and I, through the port team. So that's really cool to go to an overdose. We wake people up with Narcan, but then we put them into withdrawal and they're very sick, but then we can start the medicine to make them feel better immediately, right? And then that's how we refer them into care. We've done that a few times this week, and it's been very successful. The Edgecombe syringe program, like I said, that's meeting people in the community, building trust, making sure we're not spreading bloodborne pathogens. And a lot of times, we have got a patient who's been using IV drugs for a while, and then out of the blue moon, they say, I'm ready to get off. They already know who we are, and we can plug them in. We had a guy who I'd been dealing with for almost 2 years, and he was admitted to ECU Medical for sepsis. He had an IV site that got infected. Didn't think he was going to come out. Well, he come out, and basically the night of his discharge, he called me and said, I've been in the ICU for 3 months. I'm not going back to the bags. I'm not going back to the pills. We need to do something different. He called me. I've been giving this guy needles for 2 years. Never thought he'd get off. And he called us. We got him plugged in at Freedom Hill. We dosed him, and he's still doing well. This was 2 weeks ago. So these programs work. We just enrolled another 2 people into the program today. So we have 30 people involved into the program, and 4 of those people no longer use drugs. So that's really, really cool. And there's no telling how many infections of Hep C or syphilis or HIV that we've prevented through doing that as well. Narcan, that's a picture of our vehicles there. We have a couple community partners. This young lady lives on Ambler Avenue in Rocky Mount. She's opened basically her whole front porch into like give outs and things like that. There's food there. There's clothes. Take what you need. And we also will give her some Narcan from time to time as well. So she's a great, I think her name is Candace Herring. And she's probably listening to us right now. So appreciate you, Candace. So we work with people like Candace, Kendrick Pittman, who's out in the community. We help him out with some Narcan. There's a couple of other different partners that we work with to kind of get it to where it's needed. But like I said, just let us know if y'all have a need for that. We can order it. It doesn't cost you anything. You can buy it at the pharmacy over the counter. It's about $34, $40, depending on what you get. But don't spend that money. Let us cover that for you guys. Evidence-based addiction treatment. That's Carolina Family and Rocky Mount Treatment Center. Those were the two folks that got awarded with that. We sent it out to a bunch of different clinics in the area, but we were hoping maybe there'd be like an Edgecombe side of the Rocky Mount clinic get involved with it, but we just didn't have that bite. So these were the best applications, so we went with them. We're looking to do some more stuff to try to encourage people to get into this line of work as well soon. That's a bunch of the Narcan. These are the kits that we give out on the ambulance here. They have a bunch of different resources. At night when me and Trent are asleep and there's an overdose that happens, the EMS folks will be able to give that Narcan and give that kit to somebody, and then we'll follow up on that either the next day or shortly thereafter. And they're already kind of aware of who we are because they see our name and our phone number on the brochure. So that's really nice. Couple of upcoming events, just kind of as we're wrapping up my piece today. So on Wednesday, June the 18th, we're a site for statewide port training. So if anybody wants to be like Trent when they grow up, they can come to this event and learn more about it and learn what it takes to do overdose follow-ups and things like that. That'll be at the Edgecombe Works building in Rocky Mount. And then this is a really cool art exhibit coming up on the 24th of this month. I keep thinking June is further away, but it's like this month.
It's here.
And it's here. That's going to be in like 2 weeks or 3 weeks, I guess 3 weeks from today, right? So that'll be held at the Mobley Atrium in Tarboro at the Edgecombe Community College campus. And what this is some of our participants that came through the program, they've done really well into their recovery. They've taken some pictures and put some captions with them to evaluate their path to recovery. What are the challenges that they've had? What are their biggest support system? What has worked well? What has not? And to do like a review of our county on how well we responded to them. What services did they get? What services did they need? What did we not provide? So we can kind of figure out where to go from that. The governor's wife will be here for that. So this will be a really, really huge event. We'll have it catered. So looking forward to that. It'll be probably from like 5 to 7:30. Yeah. But it'll basically be a little quick session of, hey, appreciate y'all for coming. This is about the project. And then you get to go see those pictures that the people posted up. So it'll be really, really cool. Love to have anybody who wants to come. This is the survey. This is where you can give us some feedback if you'd like. But I'd love to just kind of open up the floor for some discussion about maybe things that y'all have noticed, maybe questions you might have, or things we could work on, do better, or if y'all would like to give us compliments, we'll take those as well. So. Go ahead, Michaela.
Are y'all doing anything for the families of the people that are in your programs?
Yeah, so we have these brochures. It's the Geisinger dealing. It's like the family. It's like resources for the family. I forget what it is, but we just started putting those in the kits. But that's like a wealth of resources for getting the family because they get so frustrated and trying to work on that as well. Yeah. So I need to figure out what that is, but that was something we just started adding in to the kids because that was important. We don't just always meet the patients, but we have to deal with the families as well, and that's heartbreaking a lot of times.
And that's one of the big differences between option A and option B is that the option A strategies are intended to only impact the actual substance users versus the option B strategies that might have a broader community effect have to go through the collaborative strategic planning process, which we want to do.
Yeah.
But that's kind of one of the barriers that's in the way to go up more too.
Yeah, it's a great question.
Well, I've had questions. So I know we talked about opiates, but I don't know, maybe Trent, can maybe talk about the vaping, like with Edgecombe County, are we seeing a lot of numbers with teenagers with the vape?
Yes, definitely. It is on the rise. The smoke shops and vape stores, they'll sell them to people that are under 18, even though they shouldn't. Of course, vapes could potentially be doctored by your friends or whatever. I've seen videos online of people tearing apart the cartridges, and then who knows what's in there. Of course, don't really see stuff mixed in there like from the store necessarily, but your friends may not be your friends, right? So that's been a big deal. There's a lot of stuff in the vape shops that is not necessarily good for you. One of them is kratom, for instance. I did some research on that. It activates the same receptors in your body as opioids does, but since it hasn't been scheduled yet by the government, it's not considered anything bad yet, right? So we can still sell it in the smoke shop. So that's unfortunate. Hopefully that'll be changed soon. But the biggest thing is just to avoid.
Because someone was telling me that, like some of them may contain fentanyl.
I don't think we have seen that.
Yeah. We don't know, right? Because there's so much going through. It's hard for us to test like a vape versus testing a pill or something. But Trent actually went and followed up with an overdose in Rocky Mount the other week. If you'd like to talk about the triple overdose, a little bit about what happened in that situation.
Yep. So I went to Rocky Mount. We had 3 young men in Rocky Mount who overdosed, and we had no idea what was going on. So I went and did some detective work, ended up at everybody's house. And turns out 2 gentlemen went over to another guy's house and they were going to smoke marijuana, and that was their plan. Well, what it sounds like is maybe the person who had the marijuana crushed up fentanyl pills and put it inside of there. So that localized can occur. And of course, they all 3 overdosed with that because they had never done fentanyl, the 2 of them. And then, of course, the guy, he normally snorts it, and smoking it gets it into your body really quick through your lungs. So you got a lot of blood flow in there. So they all overdosed. And luckily, the one who does use fentanyl stayed awake long enough to call 911, or else they may not be with us.
Yeah. And they were pretty young too, right?
16, 16, and 18.
Yeah. We've got a number of, 15, 16, 17-year-olds that are hooked on the pressed pills because those look just like medicines. They can be, this powder, right? They put it in a machine and out comes the thing that looks just like a medicine. If you were to type in the numbers that you see and the letters on the pill, you can Google it and it comes up as Percocet. But what you are taking into your body is anything but.
Yeah, it's just that because I'm a medical coder, so we see that fentanyl being given for patients for pain. You know what I mean?
Yeah.
And it's just amazing how it's all out on the street now.
Yeah, and there's different. Yeah.
Pain,
There's so like if we walked out of here today and we broke our arm, the EMS truck that comes may give us fentanyl, but they know exactly how much they're giving.
Right.
And guess what else ain't in that vial? That's it. It's just fentanyl in the vial, right? And we're given 50 micrograms, which is a very, very, very small amount, right? Someone who goes and takes a fentanyl pill, right, pressed from somebody who don't know what's in it, there may be 2 milligrams, So that's, we're talking 100 times stronger in that pill than what the EMS truck's giving you in the back of the ambulance. And there's you can't tell this one has got fentanyl in it, this one don't. They all look the same. But when they're mixing that stuff up, it's just like playing Russian roulette, So that's what's kind of scary. And back in April, we had a medicine come through, because we're doing the drug checking. It was called carfentanil. Y'all may have heard of that before, but it's about 100 times stronger than fentanyl. So it just takes very minor amounts of that stuff to truly overdose somebody, especially that doesn't have an opioid tolerance. So yeah, it's really scary stuff. The pills, I would say, of the people we dealt with 10 people this week. I would say at least 6 of them are probably on the pills. Mm-hmm. And that's a big change because usually people our age are not doing bags, right? They're doing pills. So yeah. Any other questions? That kind of wraps up what my part was tonight. But like I said, we're here to talk about the issues. We're here to talk about drugs or ideas or how we're doing as a county. So I'll open the floor up. Any other questions? Yes.
Are y'all seeing xylazine or
Yeah, that's a good question. Funny story. We did not know xylazine was here until we started doing the drug checking. Had no way to tell. So we started doing drug checking about 2 years ago, September of 23, and almost immediately in October we discovered that xylazine was here. Xylazine is a horse tranquilizer. It's not approved for humans, and it has both been detected in the bags and the pills. The problem with xylazine is that it does activate the opioid receptor, so it's very addictive, right? But also it causes your blood vessels to get really, really small. So if you have abrasions or wounds on your arms, it makes them worse. It basically can cause a chemical burn on your arm, and it's very, very hard to heal up. We can't just go and sling antibiotics at somebody with these wounds and think they get better because they're not infections, they're chemical burns. So xylazine used to just be in the bags, but about a year and a half ago, we were the first ones on the East Coast to detect xylazine in the pill form.
So like, do you buy? And I truly don't know. Do you like buy that at Tractor Supply or Rural King, or is it like a vet med situation?
It's kind of a vet med, yeah. But to my understanding, it's not that hard to get, if that makes sense. But it's not approved for humans.
So, because I work with farmers. Do you see a certain demographic of people using xylazine over?
Yeah, that's a good question. So xylazine is not desirable, but you don't get a specific user effect from it. So people don't want xylazine in there. So we don't see like a specific age group like that. This is where the xylazine is. This is where this is. Sometimes we see high levels of xylazine in all the dope, and sometimes we see small amounts of it. But it has been here for a year and a half or so, 2 years at this point. And we've got a lot of cases of nasty pictures that we can show you all about, how this can burn your skin and stuff. And it don't matter if you smoke it, snort it, inject it, it can cause those wounds. Yeah. There were some other, I think our drug library of different chemicals that were sold as either Percocet or heroin, I think we're up to like almost 50 different chemicals that they've been over time. We had a substance in April that had 13 different chemicals in it. Yeah. The perks, they're even worse because they weigh so much more, right? So average Percocet's 80 milligrams. That's about the weight. A bag is like 20 milligrams. So you're getting much more drug in the perk. So we see people, a lot of times they get hooked on the perks and then they're doing 20 of them a day, right? And they're not even feeling anything from it. They're just trying not to feel sick from those withdrawals. Yeah, it's really sad.
You keep talking about the bag. Explain that to me.
Yeah, so the bags or the bindles, that was traditionally how heroin came. So imagine like these little glassine bags here. I'll pull some pictures up for you guys to see. Because it is kind of interesting.
I appreciate the education.
Yes. We take that for granted. We've learned a lot from the street. I meant to do this last time. So, let's see if I can do like presentation mode on this. So this is like the street drug updates that we push out every month. And it's all of our drug testing that we've done. So what you see up here is a pie graph with all the colors, right? And then here we take a picture of either the bag or the pill or what substance we have. So this one, for instance, is this glassine bag. It's a wax bag. They call them bindles, right? And in the bottom is just a flake of powder in there. 20 milligrams worth. Just small amount, right? And most of the time, those bags have like a stamp or a design on them. This one looks like the Dove soap logo. So we called it the Dove stamp from April. Sometimes these stamps will change in our area. These things are usually already stamped and ready to go when the drug dealers bring them down from up north most of the time. And sometimes they stay the same. But so like let's see if I got like Prime Time. That was one of them up there. We've seen Prime Time for months and months and months. But every month we check Prime Time, the ingredients are different, if that makes sense. So think of this as a beer bottle. All right. So this is Michelob Ultra. It's all sold as beer or heroin, right? But Michelob Ultra has this. Coors Light, which is the Chips Ahoy one, has that, right? If that helps you kind of think about it in that way.
Wow.
Yep. So This is the one with 13 different stamps. It had or substances. It had xylazine, p-fluorofentanyl, which is stronger than fentanyl, Tylenol, lidocaine. Anybody been to the dentist to have Procaine, Novocaine? Medetomidine is given to you in the operating room. Its other name is Presidex. We did have some heroin, right? But it's all this other stuff. BTMPS is an industrial chemical that can affect your heart. So it's really, really scary stuff here.
All of this was in that bag.
Yep.
Okay.
Yep. So we take either a scoop of that powder or we swab it out if it's been used, and we send it off to UNC Chapel Hill, and they let us know what's in it.
And so people don't know.
They have no
They
idea.
have no idea.
And the people selling it have no idea. It's just powder. You don't know. We have some test strips for like fentanyl and xylazine and some other substances, but it doesn't tell us that quinine is there or Tylenol, right? Quinine is there. Quinine's a malaria drug, right? You can get that from a doctor's office, but it has a bitter taste. Heroin also had a bitter taste. So somebody says, "Oh, I'll tell you what's in there. Let me just taste it. Tastes bitter. Oh, that's heroin." Guess what? It might be, but it's also 12 other things as well. In February, we had a lot of people using cocaine that were overdosing, and it looked like they were overdosing on fentanyl. And they were, but they just used cocaine. Fentanyl was in the cocaine supply real hard in Rocky Mount. So we test cocaine, we'll test perks, we'll test whatever, just to understand what the trends are. And both cocaine samples that we tested in April were cocaine. But that was not the case in February. So people that, just because you use cocaine or just because you use vapes or whatever, doesn't mean that it's always going to be the same. Things can change very quickly. Chips Ahoy, like I said, a lot of the same chemicals in this, just different makeup. Frosted Flakes. This one was called Jaguar. This one is 6-star. Sometimes we'll take the same bag and test it multiple times, and we've seen some changes with that. This one was pretty close here. That was cocaine again there. And those are the perks. So y'all see, I know this picture's kind of small. It has an M up there, and on the back side it has a 30 or whatever. If you Google that, it's a Percocet. But fentanyl, if this was a Percocet, it will be 100% Percocet, right? But it's all these other things like carfentanil and xylazine and fentanyl, right? So we're really nervous about this. This is a really great project for helping to educate our community. We're the only EMS system, to my knowledge, in the nation that's doing this type of work. And Trent goes and gets samples from an overdose call. Or somebody calls them up and says, "Hey, I'm using bags or I'm using pills. I want to know what's in them." We go out there and do that too.
How quick is that turnaround time?
About 6 business days. Yep. Which is fast. So when law enforcement sends their samples off, the same machine that tests their samples we use with this. And their results are anywhere from 4 to 6 months. And when they get their results, they may only get fentanyl and carfentanil because those are the scheduled medications, right? Those are controlled substances. But they don't see some of the other changes like medetomidine or Procaine, right? And those are equally as important for us to know if we're trying to help people get off of drugs.
What's the 4?
4-AMPP is like when they make fentanyl illegally, that's a byproduct from that. It's like the heads and tails of moonshine. Like if y'all want to be a part of the email list, we're happy to add you. We send it to probably 500 or 600 people across the state, and it's really interesting stuff. So if you got buddies that are doing perks and things like that, definitely, tell them about what you've seen today. But also make sure you have naloxone. Make sure y'all have got our numbers. We're happy to meet them, schedule something out. We come by ourselves. We don't bring law enforcement. And everything we do is free. Nothing costs money.
So when you're getting these drugs from the pharmacists, it kind of make you wonder, is it the real?
Yeah, if it comes from a pharmacy,
Oh, okay.
yeah. We have not seen overdoses and stuff like that. I don't think that's common at all. But I mean, conspiracy theorists maybe have a different opinion for sure, but yeah. So We have actually seen Delta 8, Delta 9, and cannabinol in the opioids. We have seen the active ingredients for marijuana and opioids, but we have not seen, until just recently, we have not seen opioids in marijuana.
And you're able to do that, the vapes, those pens, to see what's in the pens. Are you able to test those?
Yeah, we'd have to probably destroy it to do it.
Right, yeah.
I don't know how much value that would be, but yeah,
Yeah.
it could be interesting.
Yeah.
We have got some test strips that we just got them in the other day that will do like THC and some things like that. But yeah, just give it. I mean, we'll look at it. Maybe Trent can take it apart or something.
I'm sure we can.
Yeah, we'll figure something out.
Take anything apart.
Yeah. Yeah. So I mean, hey, whatever we can do to kind of protect people, we're down for. Any other discussion or thoughts?
Fentanyl.
Yes.
Ain't that dangerous just touching it?
Yeah, great question. That is one of the myths that goes around. Fentanyl is very poorly absorbed across the skin. So as long as your skin is not broken and you're not like walking into a cloud of it, right? Because that's intranasal. Fentanyl will not just overdose you like that. So if you're walking down at Piggly Wiggly to get a box of cereal and there's this white powder on the side of it, you can't just touch it and all of a sudden you're in the floor. But like if you inject it, if you snort it, things like that, it takes just a small amount. But that's a great question. Yep. That's a great question. And you don't need a lot of naloxone to fix somebody's overdose from fentanyl, right? All we're trying to do is just help their breathing out. Because the more naloxone we give that person, the more sick they will become. Like when they do wake up, right? That withdrawal, we can make the withdrawal worse. And we don't want that to be when we leave out of there, they go to the hospital or we leave them at home because most people refuse to go to the hospital. You know, that's where we start them on medicine and things like that. But some people don't want the medicine. But if they get sick, what's going to make them feel better? They're going to use it again, right? And the substance they just had that overdosed them, you know, that's not a great choice. So more is not always gooder, if that makes sense. That's my country way to say that. So less Narcan, the better. And like I said, we've got plenty of it here. So please take a box.
This is a demonstration.
Yeah.
Well, that's what I was gonna say.
Yeah, we should.
Do y'all have a video of, just real brief
Yeah.
of how you know, built to.
Trent, you want to? You go?
I have these 4 or 5.
Go. Yeah.
Yeah. So basically, this is exactly how it looks from the box, except for this is a trainer model, just like the EpiPen trainers. So you hold it like this, it goes in their nose, you point it towards their ear, you push this up, and it does a mist into their nose. But don't test it out. Once you push it, it's all gone. That's all 4 milligrams or 3 milligrams, depending on which one you get, is what's going in there. Y'all feel free to play with the testers, and that's all you have to
And
do.
that's it.
That's all you have to
This
do.
only contains 4 milligrams.
It will contain 3 or 4, but
Oh, 3 or 4.
a majority of the time that is plenty. When we give it in EMS, we start out at 0.4. So
I don't even know how. Oh, you turn it.
you turn the top of it, it'll reset it.
Yeah.
Okay.
Yep. But yeah, so we start at less than half of this dose, so it's a lot, and it does take a few minutes to kick in, but most of the time it works very well.
So if they're completely out, and you do this, you want them to start breathing, to come around. They start coming around.
And depending upon the chemical that's involved here, they may wake up or they may not. But our goal is to just get them breathing, right? Because if they don't look like they're breathing, this will help them breathe. But some of the other stuff, like the xylazine, the tranquilizers, the Presidex, they may not start to like reanimate, right? So that's to be expected, right? So as soon as you notice the overdose going on, give that and definitely call 911. Because it may be that person still needs to go to the hospital, right? And if somebody's like passed out, we want them kind of on their back when we give it, and then we want them to kind of roll on their side, because if they wake up, or if they don't wake up and they're extremely nauseated, we don't want that going into their lungs, right? That is one of the withdrawal symptoms is vomiting. So get them on their side, kind of like a seizure patient after they've had a seizure, right? That way if they get choked up on their tongue or whatever.
No Narcan with me. I don't know. I can't get my finger.
Anything else for us
Well,
today?
one last thing,
Yes.
it's my third presentation and I've enjoyed all three. I know I've already spoken to Antwan, but, I want that for the record. You all would travel, out of the county. And the reason I'm asking, I'm a member of the Eastern North Carolina Civic Group, and we have 3 counties from Edgecombe, from Edgecombe, right now, back to the coast. And, we meet every second Saturday. So, I try to get it so y'all can, do a presentation. I mentioned to us, we meet every Wednesday night on the phone. I mentioned to them last week, and some people didn't even know anything about it. That's why I asked the question earlier. You'll find out sometime I ask questions, I already know the answer. But for the record, that's why I asked that question. Like I said, they're from all the way down to Barrett County.
Yeah.
And I hear y'all going down there. I know he's going down
Yeah.
there. And I know a councilwoman down there. She's our secretary. I know a lot of people across the state, so I'll call tomorrow night. I've already talked to them about trying to get y'all to come to Winston. We're meeting in Winston now every second Saturday. But we go around from county to county. The county just involved.
Yeah.
Because all of them are not involved right now. But we try to represent them. So, I'm gonna try to get y'all, I'm gonna get with them tomorrow night and see if y'all schedule work out for, I don't know what we can do live tonight. But we got a banquet in, Carville on August the 9th. Scholarship banquet. So it may be out past, it might be September.
That's fine.
So September probably gonna be the best time. Yeah. And I know we're supposed to start moving around the county again.
Okay.
And I think it might be, Martin or Barrett, but it may not be, Williamson. But anyway, we'll get that worked out. I'm gonna shoot for September.
Cool.
And, I'm glad to hear, Edgecombe County, this is where it started at.
Mm-hmm.
We said the only across the nation, right? Basically.
So, some of the things,
Right,
yes.
some of the things.
Yeah, some stuff we had to steal from other people.
Right.
Which is, because it was working, right?
Right,
We
right,
feel like
right.
we do it good here.
Don't reinvent the
But
wheel.
that's all right.
Tell people all
But
that.
yeah,
Don't reinvent
we
the
definitely
wheel.
have some statewide
You
attention.
what's out there, so.
Yep.
But, I appreciate all y'all doing it. I'm trying to catch everyone I can. I'm trying to catch the one next week. I have
All right.
scheduled, so I'm looking forward to that job, so.
Yeah, happy to have you
My
here.
dad is 91 years old, so. Yeah, so.
All
I
right.
appreciate all y'all doing.
Yes, sir. Thank you.
And I try to get it out. Cool. So here's live. Anybody want to go back and look at it? I'm doing it live. I give you my card. So
What's the youngest age that somebody could be a part of this program, and at what point do law enforcement become involved?
So, I think the youngest person I've dealt with is 14. 14, 16. Obviously, the parents have to be kind of involved. There is a law in North Carolina that states any youth that desires to get substance use treatment can go and receive that treatment, no matter if there's a parent there or not. So that's the thing. And as far as like law enforcement, I guess like what context maybe?
I didn't know if there was ever, let's say a 10-year-old got into parents' drugs, and are you obligated to report that to law enforcement? Or if an adult is using, if at any point do law enforcement become involved?
Yeah, so we really don't have an obligation to involve law enforcement. There may be an obligation to involve DSS or something like that, depending on the situation. But as far as law enforcement, as long as the providers are safe there, we don't really have to involve them at all. Anything to add to that? Yeah. All right. Thank y'all for coming. Appreciate it.
Huh?